Don't let the holidays linger. Throw the high-rate credit cards out with the eggnog that's gone bad. Visit Freedom United Federal Credit Union, member NCUA, equal housing lender.
Your success is our success. We belong to you.
Do you have a lot on your mind? So does Eddie Crow. Tune in to Beaver County Radio every Monday through Friday from 9 a.m. to noon for Something to Crow About with Eddie Crow. Eddie has a very unique outlook on things happening in our world today, and he will share that outlook with listeners. We'll also have monthly guests, as well as ones that are making the news locally, regionally, and nationally. So set your clock to tune in to Something to Crow About with Eddie Crow. Weekdays on 99.3 FM, 1230 WBVP, and BeaverCountyRadio.com. You're listening to 99.3 FM, presented by St. Barnabas, in addition to 1230 WBVP Beaver Falls. Welcome to the Best of Beaver County, presented by St. Barnabas, a weekly segment dedicated to putting the focus on the amazing things and the amazing people behind them in Beaver County. The Best of Beaver County is sponsored by and content is provided by St. Barnabas. The show airs every Thursday from 11 to 11:30 on WBVP, WMBA, 99.3 FM, and Facebook Live. Now, with no further ado, let's welcome host Mike Romai to introduce today's program.
This is all about interesting people and places in Beaver County, and believe me, this is one of those places that makes Beaver County special. It's the Gateway Rehabilitation Center. It's located in Center Township, just off of the center exit. Some people would say Aliquippa Center, Hopewell. It's Broadhead Road and all that area out there. Gateway Rehabilitation has been serving our community for more than 50 years. I'm old enough to remember, not when it opened, but Dr. Abraham Twersky, who founded the organization and did such outstanding work for people with alcohol and drug addictions. And joining us this morning on the program are TRACY PLEVEL and Karen FRAHOLI, who are both vice presidents in their own right in different departments. TRACY, welcome. Karen, welcome to the program.
Thank you.
You are the Vice President of Programming? Development
Yes.
At Gateway. Mm-hmm. And you have been employed there for how many years now?
Since 2017.
2017.
Yes.
Is it something that you always wanted to get involved with? What drew you into that line of work?
Well, I'll be honest. I knew the recruiter at the time.
Okay. Hey, we all need to know somebody.
And I was looking for something new in nonprofit work. I had taken a break from nonprofit work, and so I started working for Gateway Rehab. I wanted to give it a try, and that was the end of that. I've said now I'm staying there until they kick me out.
Okay, very good. And Karen, you are?
I am the Vice President of Recovery Services. So essentially that means I oversee the clinical programming that we offer throughout the Gateway system.
And what drew you? I mean, how many years have you been there?
24.
24 years.
So I was an intern in graduate school, and I wanted to give it a try and see, and I was always interested in substance use disorders, so I did that, and believe it or not, I got offered a job as soon as I graduated graduate school, so May 2nd, 2000, and I also am a lifer. I don't know that I thought that originally, but I started working with adolescents, and here we are.
One of the words that comes to mind for me, not being in your profession, obviously, is the word challenge. It seems to be a very challenging profession. Maybe rewarding, but very challenging. Can either, since you've been there for 23, 24 years, challenges, have they changed over the years? Is it something that you got into it for?
The one thing I would say about the treatment that we do for folks that have substance use disorders is that challenge is an excellent word. And the challenges vary based on the time. So for example, challenges just in regards to the basics of, folks that need help that maybe don't want help, and the challenges there, and the family dynamic and friends and peers. But then you also have challenges in terms of funding, in terms of getting people to where they need to be, in terms of having availability. Our biggest challenge since COVID and the pandemic, and I hate that we still talk about it, but we have to, is staffing. Our biggest challenge over the past couple of years is having people that want to work in this field or are willing to do the work that's required. So that would probably be our biggest challenge right now.
One of the things that I pick up on in doing these interviews is listen to the words that people use. I remember many years ago talking about homelessness, and we talked about a homeless problem. Now it's what do they call it? Unhoused. They say people who are homeless are unhoused. I say addictions, and you say
Substance use disorder.
Yeah.
New
When do we
terminology.
change that? Yeah.
We changed that probably, I don't know, maybe 2 or 3 years ago, I would say, and there's a real push to change that because we want it to not be associated with who the person is. It is a function and a disease of the person, but it's not the person, right? So we try to make it a little bit more general. Addiction has a little bit of a negative connotation to it. And I think we're really trying to look at this as a whole person and really have more of a positive feeling about that. You know, some of the old words that you used to hear when you would refer to people that had addictions would be junkie, you know, things like that. Drug addict, bum, you know, and then you have these stereotypes. Well, it drinks out of a paper bag and, you know, beats his wife or she beats her children, whatever it may be. We really, in our field, are trying to get away from that and trying to lessen the amount of stigma associated with the substance use disorder and making sure that we're treating it as a disease.
And does that make the individual feel better about themselves?
I think so personally. I think we all feel better. It's funny, having been someone that has worked in this field for a long time, just talking to someone recently, the way that we used to run groups and do treatment was very much confrontational. That's the way it worked. Now
Tough
it's
love?
so, yes, a lot of that. Now it's so the opposite. So I do think that it helps people not feel as if they're being judged or the stigma around it.
Yeah.
And that's one of the things that are, it makes it more challenging for them to ask for help, knowing that folks are going to think of them in a certain way.
Stigma attached to it.
Yeah.
Now, not to get political, but in this day and age, people say, "Oh, you're just being woke." You know, yeah, make everybody feel better. You say these words, and that makes them feel better. What's wrong with that?
If they say that to us, I guess really that's an opinion, you know, and if people think that. But I think for us, again, if you work in this field, you don't work here just to have a job to make money. You have to want to work with the people that we work with, right? So I think you have to have a sense of, you know, being okay with what people, I mean, a lot of people will argue with you that addiction's not a disease and it's a choice, and people make that decision. If you work in a substance use disorder facility, you know it's not a choice. I mean, that's easy. So I would say, you know, yes, people would believe there's some political correctness to that, but we're really trying to treat the person and the family and the dynamic and so what?
Yeah, and I
I
would say,
understand that.
you know,
Yeah.
if we're changing the words that we're using to make someone else feel better, if that gets that person in treatment, isn't that the point?
Sure. Yeah. And it's like people who are on assistance. And we used to have welfare books. You know, you used to go to stamps and tear them out. We changed that because there was a stigma attached to that. And people would look at it and say, oh, yeah, that person. It's the same thing with the issues that confront many people in our society today.
Sure. Same with mental health. I mean, we talk about mental health disorders totally different than we used to. And you don't use the words that are stigmatizing like crazy or, I don't know, there's lots of them. But, you know, but those are the words we don't use anymore.
Yeah, it's remarkable. And when you're dealing with mental health issues, and that's something you deal with at Gateway.
Correct.
Is it a part of the problem? Is it, you know, or do they have mental health issues? Because now, again, in society, they say, well, these people are mentally ill. It's not because of this, it's because they're mentally ill, and we need more places to take care. We don't have Dixmont's anymore. We don't have these facilities to take care of crazy people in our society.
Right.
And so there's the stigma that is attached to all this stuff.
Sure. And the question always is, and the question we're asked often is exactly what you're saying. Is it because someone had a mental health disorder that they now in turn have, started to use drugs to cope and then have become addicted? Or was there a substance use problem prior to mental health? So what I will say is this, it happens both ways. But 80%, at least 80% of the people that enter into substance abuse treatment have a co-occurring mental health issue. Does not mean it's something that's long lasting. It could be something that is, related to the actual use of substances. But most people will come in. Common ones are going to be anxiety and depression, right? But then you get to a place where you hear more significant. So I will say that we've just opened a co-occurring unit, which means that you have both a significant mental health and a significant substance use disorder, and we treat both of those at the same time. And the treatment and how we interact with those patients is different than how we interact with our patients that are not in that program.
Sure. And as we go along, when you talk about anxiety and depression, a lot of people may find themselves self-medicating because there are medications out there, and some people just refuse to take them, and so they self-medicate, and that's when they turn into drug and alcohol problems.
Sure. Sure. And there are a lot of medications that you can take for those disorders that you willingly take but have addictive properties. And then sometimes what you do is you self-medicate over based on what you've been given.
Have either, maybe you did, Karen, work with Dr. Tversky?
I did.
You did. Is his, the way he guided the organization way back when, does it still hold true today? Are the fundamentals still inherent in what Gateway Rehabilitation does?
I would say absolutely. If you had met Dr. Tversky, he was the kindest, most gentlest, but most amazingly intelligent human that you could meet. You would think he was going to talk about something extremely boring, and then you would listen to him and say, this is really profound. It's very profound in a very easy way. So what I would say about him and where he has, he's still part of us is the fact that we continue, one, to treat people with substance use disorder, two, that we have expanded beyond any, I think, facet of what he thinks we could have done at that time. And we continue to just make that next step so that we can help more people than maybe we were helping when we first started. When we first started, it was just the Gateway Farm out there in Center Township off the exit. And now it's, so much more. I mean, we have over 350 beds in our facility, meaning not the facility in Beaver, but just in general, to give you an idea. We have 9 outpatient locations. We have 3 halfway houses, soon to be 4, Department of Corrections. We've got a lot of stuff that we do to help the communities.
And Tracy, a lot of people think, well, it's somebody else's problem. It doesn't affect my family. It doesn't affect my neighbors or the people I go to church with. It's somebody else's problem. Nothing could be further from the truth.
Yeah, I mean, I don't know that there is actually anyone left that this hasn't impacted in some way.
Yeah. I come from the era of sex, drugs, and rock and roll, the 1960s and 1970s, when people were smoking pot and, all kind of other things. But it has spiraled out of control, it seems, and at a much younger age than teenage years and into older age people. Maybe some of those people who are now 50, 60, and 70 are still flying high from, those experiences back then. How do you get a handle on that? Because there are a lot of people who come to you because of law enforcement, because losing their jobs, losing their families.
Well, so even if you come in and it's not internal motivation and it's an external motivator, meaning legal, families, husband, wife, brothers, sisters. It's our job to work with that person to get them to a place where hopefully they're going to acknowledge what they need to do differently in order to avoid the situations that would put them in harm's way. But I think you bring up 2 good points in terms of populations, and we are serving both of those populations and serving them very differently. So one, we are going to be opening an adolescent program, a residential adolescent program on our Center Township campus here hopefully in the next month or 2 by March 1st.
Define adolescence.
Adolescent's going to be 13 to 18. Can
Okay.
go a little bit older than that. There's some legalese with that, but 13 to 18, a 12-bed unit, very small, but we are going to specifically focus on adolescent treatment there, which is very different. very different. There's a lot of family involvement, and we're very excited to get that going. We've done it before, and it is something that we do very well. But on the other side of that, we also have a very specific program for people that are over the age of 50. We actually named it after our previous medical director. Well, we named it after him, Neil Capretto.
Oh, I knew Neil.
Yeah. It was his vision and his idea that we specifically had a program for people that were 45 plus. We bumped it a little bit to 50 because after the pandemic or during the pandemic, we saw that much older people maybe had sobriety and recovery, but they had relapsed and were in a really bad situation. And so the average age has gone up in our older population. So, and that unit is always full. And they are so happy to have that very specific unit that focuses on them and their needs and their ages, which usually include comorbid medical issues, oftentimes.
60 is the new 40.
60 is the new
40. So you're dealing with those problems as we age.
Yes, absolutely.
And 13-year-olds raiding their parents' liquor cabinet is the thing that comes to mind first because where they're getting introduced to this kind of stuff. But I guess as we age, we don't see what's happening in the schools and in the streets where our kids are playing. We're going to continue our conversation with Gateway Rehabilitation Center. Karen FRAHOLI and TRACY PLEVEL are our guests as we continue on the best of Beaver County.
Is one thing. Having anxiety about falling is a whole different subject. If you or a family member are concerned about falling, and yes, either up or down the stairs, or maybe even out of bed, St. Barnabas has a special message and some ideas just for you. Years of experience in working with people who are prone to falls has given St. Barnabas special expertise in this area. Call them at 724-443-0700 and learn about ways that you can begin to feel more confident and safe, including suggestions that you can implement right now into your daily routine. Call St. Barnabas at 724-443-0700. For many years now, St. Barnabas has been helping people fall, in love that is, with their new, better life, a longer life, a risk-free life. Call St. Barnabas now at 724-443-0700 or visit stbarnabashealthsystem.com and learn more about living longer and better.
Like substance abuse problems in our society, Gateway Rehabilitation Center is one of those places that you don't always hear about. You don't even know it's there unless you've needed it. Substance abuse issues are also one of those things. If you don't have it, you don't see it going on around us, and it's all around us. As we were talking with our guests, Karen FRAHOLI and TRACY PLEVEL, talking about from 13 years of age, an adolescence program that you're instituting, to even as we get into adulthood, far into adulthood, 50s, 60s, 70s, prescription drugs and things of that nature. Those are all issues that families have to deal with and are fighting about today.
Yep.
Yeah. And tell us the adolescence program. You talked about COVID, and you had something like this prior to COVID, but people stopped going to doctors' offices. People stopped looking for help. They just were trying to hunker down in their own homes and stay away from people. Tell us about this program and what it can do for Beaver County.
So this is an amazing program that we've had a lot of support from Beaver County SCA and the commissioners to get this program off the ground. It is a need. We are sending our children in Pennsylvania, Beaver County included, to other states to receive treatment. So we find ourselves, and we know that we're an expert in Western Pennsylvania, so we really wanted to work with them to get a program going. So this is going to be for boys and girls, young men and young women, and it will be specifically no more than 12 beds. But we're really going to be focusing on them, and they have different issues than an adult. So it's school, it's peer pressure, it's I can't be kicked out of my house. We have adults that someone says you're not living here anymore, and you're not living there anymore. Well, these kids don't have that. So we're really spending a lot of time working with the parent or the guardian and working with them to help them identify what are consequences, what are risks, and how do we work on behavior change and keeping them safe.
Is it behavioral? Is it mental health that we're dealing with?
Can be a lot. Our young people, I will tell you, often have a comorbid mental health issue.
What does that mean? You mentioned it earlier with adults.
It just means that there are two major issues going on at the same time. So, we know if you continue to use drugs and alcohol that you're going to probably have medical issues related to that, or medical issues that can't get better because of your use of substances or alcohol. And with our young people, oftentimes there is a mental health issue going on. The typical things that we see with our young people are, again, anxiety, depression, attention deficit disorder. We also see young people that are doing self-injurious behavior for relief of anxiety and depression, and that just means that they're cutting themselves in order to feel some sort of release. So we have to deal with a lot with the young people. They require a lot.
And parents, if there are parents in these situations, a lot of times there's not. They come from broken homes, they're shuttled one place to the next. But parents are often the last to see these things. Oh, no, my kid would never do that.
Well, as a parent, and I think we know, as being a parent, it would be very difficult to, I acknowledge that. So it's really our job to work very closely with the parents or guardian or whomever is involved in their life. We see everything. So we really want to work with them. And then we want to work with the other agencies that are potentially involved with this family, right? So if there is a caseworker or there's probation because there's legal issues, or it's the school, we want to work with all of those agencies so that we can all be on the same page to support this young person to do well.
I will say too, however, one of our top 3 sources for someone to come into treatment is the family. So we're often getting contacted by parents who would like to get their son or daughter admitted to treatment and just need to know where to start. So
We're all looking for a quick fix. I don't have time for this. I got to work. I got other kids. I can't be spending my time coming to meetings at Gateway. Are we all looking for a quick fix?
It happens.
Yeah.
I mean,
I'm
there's
sure it does,
certainly people, but really when someone is at the point of requiring a residential treatment program, and not everybody needs that. People start in outpatient and they can start in our Center Township outpatient easily 1, 2, 3. But there are people that works well for, and we're the experts, and we know that you're not going to be successful if you can't get out of bed without using a substance. You're not going to be successful in outpatient, right? We need to wrap around you and give you a geographical escape, and you sleep and eat and live with us, and we program all day long, and we give you lots of stuff to work on.
If you were a parent and you didn't have any of these issues with your children, you don't understand it. I'd just throw his ass out. Why would you keep him? You don't have to put up with that. If you're a parent who cares about your children, you can't. You can't deny it. You can't walk away from it.
You can. Now, if they're, certainly if they're an adult and you're, because you're a parent forever, and if you're an adult and, you have set the boundaries and that adult child is not following them, then of course you have to set boundaries. But when you're talking about young people, no. I mean, so you've got to think about that a little bit differently, and, really getting involved in something and working in a therapeutic relationship is the best way to do that.
One of the problems, one of the struggles that we have in society with these kind of treatment centers is insurance. Insurance. I've heard many parents who have children who have problems, and okay, we'll keep them for 6 weeks. After 6 weeks, your insurance is done. You got to go. You got to find someplace else. It's not always possible to do that. How do you work with the insurance companies through this?
Insurance is always a challenge. Remember, we talked about challenge. So we have really great relationships. I mean, Gateway contracts with 134 different payers, just to give you an idea, 134, 140, somewhere in there. And we have different relationships with all of them. It is difficult. I will say that we have to do a lot of denials and reviews and get a doctor on the phone to speak with the doctor at the insurance company. But we do whatever we need to do. We have done this long enough that oftentimes we have ability to make some decisions or know a way around it to work with the insurance company and the family. The other thing I like to point out is Gateway's a nonprofit. So part of of what we do is we have to offer care at times where we're not always being totally reimbursed. I mean, we're a business, and in order to provide what we do, we have to obviously make money to do that. And again, we don't make money. We keep the lights on. We do what we need to do. But the other point to that is that, you know, we do provide care at times that we're not reimbursed for, especially if it's something to get someone over a hump to the next place or to the next authorization or whatever that may be.
And in terms of getting everything pulled together and the new programs that you're working on now, what do people need to know about Gateway Rehabilitation in 2025?
Well, I think the first one is our team is willing to talk to everyone and anyone if they have questions about this. If there's questions about perhaps misuse that you're seeing, or maybe you're concerned about your own dependency on substances, or if you're a family member that wants to get someone else help, we have an 800 number to call. It's 1-800-472-1177. We also have a website, gatewayrehab.org. There's tons of information on there, lots of ways to get in touch with us. You can chat with us online as well through our website. So I think that's a big one. I think it is something that if you haven't dealt with before, you don't know where to start. So we are here to be that starting point for folks and talk through it and share education about the disease and what are treatment options. And then, I mean, we have tons of folks that are willing to kind of help from start to finish on the process.
Well, and since COVID, we've all become accustomed or at least aware of telemedicine
Yes.
and telehealth. Does Gateway have something like that?
We're really expanding our platform on telehealth. So obviously all of our outpatients had to go to telehealth when we had the pandemic. And we've kept that up and we've continued to do it. But now what we're doing is we're expanding it so much and doing it in a way that is much better than hurry up and get this fixed and let's figure out how we treat people out of their homes. So we're currently working on an expansion of that. We do telepsych. So our outpatient locations, so Center Township right here in Beaver County, you can come in and have your, treatment for substance use. You can also see a psychiatrist. We do that via telehealth and we contract with somebody that works for us. And then we also can provide medications, and some of that can be telehealth, some of it can be in person. So we really use a lot of telehealth and only plan to expand that beyond.
Okay, and people can find out about that as well, because a lot of times they may be referred to you from the hospital. Patients getting discharged, psychiatrist, psychologist says this patient needs help in some way, and they get through to you that way. And another way is, as you said, Tracy, on your website. You can find out more information that way.
Absolutely.
Challenge, we'll use that word again, that you've seen. How is it different for people today dealing with substance abuse issues? So you already changed my vocabulary instead of saying addictions. How is it different for them today than it was 10, 20 years ago?
I think availability. I think that's really a big thing. I was working with a group in Philadelphia, and we all hear about what goes on in Philadelphia, and it's just the drug situation out there is very dire. And when you talk about fentanyl in Pennsylvania, Pittsburgh actually has a higher incidence of fentanyl availability than Philadelphia. Now, Philadelphia is dealing with some other stuff that's much worse out there, but that puts into perspective that the ease of getting medication, drugs, but also medication. I'm thinking medication in my head because there's a lot of medications out there that people take that are addictive in nature. And if they're not taken properly or monitored properly, then there could be additional issues.
Dire, when you're dealing with fentanyl, we understand. And people who don't have substance abuse issues say, why would you take that drug? Why, even though that it's out there, and I know from interviews in the past, even with Dr. Tversky or Neil Capretta, is that that's the thing that they're looking for. They're looking for that high.
Yeah.
Others of us would say, no, I don't want to touch that stuff. they run towards it.
They run towards it because it gives you a different sense of, when you start to use to the point of being physically or psychologically addicted, you are looking to feel better than you felt before, right? And so the first time you use, you feel great, and that's what can hook people, and then you keep going. But then what happens is you continue to get lower and lower and lower. So to get the upswing back up, you're not even getting back to where you felt normal before. So fentanyl is a more powerful drug, and it's something that people crave and look for. I will tell you without hesitation that when anybody comes into our residential facility and they are an opioid user, which would be heroin, fentanyl, morphine, whatever, Vicodin, those kinds of things. When we do a urine analysis, because we need to make sure that we do that when they come in, 100% of them are positive for fentanyl. So some people may think they're using heroin, but they're not.
And they don't even know.
But some people also are looking for fentanyl.
Because the dealer don't care. Mm-hmm. All right. It's great that you're still around after all these years. It's great that you're coming up with new programs that will help and assist people with substance abuse issues in Beaver County and all over, and you're continuing to bring those cases forward. Tracy, thank you so much for being with us. And Karen, thank you for your expertise on all this stuff, and people can find out more information at your website.
GatewayRehab.org.
Thank you so much.
Thank you.
Gateway Rehabilitation Center in Beaver County, doing great work for more than 50 years. They are the best of Beaver County. I'm Mike Romai. We'll talk again.
Thank you for listening to the Best of Beaver County.